Well, we're here with Dr. Bensianoff, a dentist in Linden, New Jersey, Linden being pretty close to Elizabeth, I think. Is that true, Dr. Bensianoff?
That is correct.
Yeah, Dr. Bensianoff, hi, how are you doing?
How are you doing, Helmut?
I'm doing good. Dr. Bensianoff, tell me, for us patients, a dental practice, sometimes we feel that a dentist is kind of a dentist, is a dentist, that they're all alike. And at the same time, we're afraid that they're not alike and we keep looking for something we like. Tell us a little bit the philosophy of your practice. I'm sure there are many different dental practices with different philosophies. Tell us a little bit yours. In fact, tell us, how did you become a dentist? Well, what happened there? Give us a short little rundown on that.
Well, when I was in college, I was open to different career moves, and what I decided to do, I went to volunteer in the hospital setting for the dental clinic, where I assisted residents in their dental procedures, and that's where I actually saw that I can do this, and this is something that I want to do and pursue. And ever since then, I took the DETs, applied to dental schools, and became a dentist eventually.
So you went out there almost kind of like a career day kind of things. You went out there helping people, being exposed to it, and go, I like that, and then did it.
That's right.
That sounds great. Now, tell us a little bit about your practice, your basic philosophy. What type of work are you doing? How would you describe your practice?
Well, first thing I want to say is the most important thing in my practice is caring about patients. We want to make sure that when patients leave, they have healthy teeth and healthy gums. And the motto in our office is to keep their teeth healthy for the rest of their lives. And we do everything possible to make that happen, which includes, and not only limited to, different procedures such as gum treatments and root canal treatments and crowns and implants and orthodontics, which is braces. We do regular orthodontics, regular braces, as well as Invisalign, as well as we do veneers as far as aesthetic procedures, bleaching. We're involved in different aspects of dentistry.
Okay. Well, tell me, Dr. Bensianoff, how do you feel about, dentistry? There are some, obviously there is, we can do dentistry where we get this like Julia Roberts and Tom Cruise, Brad Pitt type of smile. And I'm not saying they all have false teeth in it. Maybe they do, maybe they don't. I wouldn't know. But they have great smiles, $1 million smiles, one could say. Is your purpose to give everybody this like, hey, you gotta have all this gorgeous, beautiful smile, or is it more kind of like, look, we need to stay first healthy, functionable, so that the rest of the body functions, and then from there on you have a lots of options of how, so to say, pretty you want to get based on what you want to get, but not necessarily something you need to do because that's then pure cosmetic, almost like a good Honda will get us everywhere we want. If you want a Mercedes, fine, but it's not necessarily something we need. How do you operate when using this analogy?
Well, absolutely. Health comes first, and aesthetics come second, meaning the main goal is to have healthy teeth, especially considering the fact that there's more and more research showing that there's a big correlation between the gum disease, oral health, and the general health. And that's why, keeping your teeth healthy and as well as your gums is priority number one. Aesthetics are always good, and patients are interested. We're more than happy to provide them with those kind of services as far as Hollywood makeover, Hollywood smile. But the priority is, once again, healthy teeth.
All right. So functional dentistry to make sure that but that the person doesn't get sick and that, and teeth don't fall out and whatever is associated with it. And from there on, you also do offer cosmetic dentistry as much and as little as a patient wants it. But that's kind of, now it becomes, what do you like, Mr. Patient? How good do you want to repair this? But first you tell him how much he needs in order to actually keep his basic health.
That is correct.
All right. Well, thank you very much. We'll be talking a lot more to you, Dr. Bensianoff, about different procedures and what is happening in the dental industry, how and what can all be done. Thank you very much. Bye-bye.